Instructions to administer the medication. Menopur 1200. Before administering the medication, read the following instructions carefully. Wash your hands properly before preparing and administering the medication. Try and choose somewhere clean and peaceful to prepare the medication. Make sure you have all the necessary material ready for the injection. At your pharmacy, you must get alcohol, medical gauze, and a suitable container to dispose of the material after using it. The medication that is kept in the refrigerator must be taken out 5 minutes before using it, so that it is at room temperature at the time of the injection. To improve the effect, try and administer the medication at approximately the same time every day, preferably at midday. Don't worry if there is a minor local reaction, such as redness, itching or pain in the injection site. That is normal due to the effect of some of the drugs used. If it lasts more than 24 hours, seek help at your UR group clinic. Once the medication has been administered, dispose of the material used in the container. If you have any questions, you should get in touch with your UR group clinic. The method to prepare and administer your medication is as follows. The Menopur 1200 pack contains 1 powder vial, 1 needle to inject the solvent into the vial, 2 syringes preloaded with the solvent, 18 disposable syringes graduated at the FSH facilities, 18 disinfectant towels. Open the box and remove the contents. Remove the tape that contains the powder vial, the 2 preloaded syringes, and the reconstitution needle. The mix is prepared as follows. Remove the coloured plastic top from the powder vial. Remove the cover from one of the solvent preloaded syringes. Connect the reconstitution needle to the preloaded syringe. Vertically place the powder vial on the preparation surface. Insert the solvent syringe needle into the centre of the rubber cover of the powder vial. Slowly push the syringe plunger in order for the liquid to be inserted into the powder vial, attempting to create a flow along its wall to prevent bubbles forming. Once the syringe has been emptied, gently separate the needle's syringe by turning it and leaving the syringe in the vial. Remove the rubber top from the second preloaded syringe. Connect it firmly to the needle that has been left inserted in the vial. Slowly push the syringe plunger in order for the liquid to be inserted in the powder vial, attempting to create a flow along its wall to prevent bubbles forming. Remove the syringe with the vial needle. Gently shake it to mix the contents of the vial, avoiding shaking vigorously to prevent bubbles forming. When administering Menopur 1200, you should only use disposable syringes included in the box. Extract one from its packaging and remove the head cover that protects the needle. Insert the needle in the vial's rubber top. Insert the vial downwards and pull on the plunger, extracting the amount necessary in order to reach the prescribed dose. Should you extract more than the stated dose, press on the plunger until you reach the correct dose. Should air appear in the syringe, pull on the plunger and shake it gently until the air accumulates in the upper section. Press on the plunger to remove the air until a small drop appears on the needle and set the prescribed dose. Remove the syringe from the vial. It is now ready for injecting. The medication should be used immediately after preparation. Injection in the abdomen. The medication must be administered in the anterior area of the abdomen, about 3 fingers away from the navel. The injection site must be changed every day to improve absorption and to avoid any possible discomfort. Clean the injection site with medical gauze soaked in alcohol. Pinch the skin with one hand. Insert the needle completely, holding the bevel upwards at an angle of between 45 and 90 degrees to the skin. Inject the whole dose, pressing down on the plunger of the syringe slowly and constantly until it is empty. Wait for 5 seconds. First let go of the skin and then gently remove the needle. Apply pressure on the injection site with medical gauze for a few seconds and gently massage the area. This will favour the dispersal of the medication under the skin. If you have a suitable disposal container, put the used syringe in it without putting the caps on the needle. If you don't have a suitable container, put the caps back on the needle, being very careful not to prick your fingers, and keep it somewhere safe until you can take it to a UR Group clinic, where we will be able to dispose of it for you. Remember that you must not reuse the needles or share them with anyone else. Before carrying out the Menopur 1200 reconstitution, it should be kept in the refrigerator between 2 and 8 degrees Celsius. Once the mix is complete, keep the Menopur 1200 vial at room temperature, not exceeding 25 degrees Celsius, and in its original packaging and out of direct sunlight until its subsequent application.